And joining us via FaceTime this morning, we have Dr. Erica with St. Vincent Healthcare, and she's here with a few helpful tips and information on, what we need to keep in mind as we navigate the pandemic. So tell us, Dr. Erica, what are a few of those things we need to be mindful of?
Yeah, and especially with school coming back next week specifically, I think that this is a new stage in the game with this pandemic, and it's brought with a lot of fear and anxiety and worry on the part of parents and administrators. And so, and children as well, I think are having a hard time doing this. I think what we need to do is just go into it with a good frame of mind in terms of the safest things we can do to make this successful if possible. And that's being flexible, being adaptable, being responsible, and then being good role models for each other as we go into this.
And some of those things you mentioned, let's focus in on them a little closer. So how can we be flexible and adapt?
Right. I think just preparing your children as well as ourselves as we're going into this, letting the kids know there's a chance that we may have to go home for a little while, and then you can go back to school, so that it doesn't come as such a shock to them. Kind of prepare them for that. I think also that employers and the community members also need to know that there are going to be employees who are parents or who are household members of kids that may say, I need to stay home because we have symptoms and I need to take care of my kid. And so just being flexible and adaptable with that as well. And just know that things may change. The rules that we have right now may change as we get into this experience, and not to be surprised by that.
And with all of this comes responsibility. So what should we do and what could we do?
So for this to be as safe as possible, people just really need to hunker down and follow those guidelines that we know in terms of wearing the mask. They're going to be required in the schools, but also remember to keep doing that outside of the schools, because anything you're in touch with outside of the schools could potentially be brought into the schools and make this not a successful endeavor. Doing the hand hygiene, doing respiratory etiquette, and definitely social distancing. It's hard, it's difficult at times, but staying your distance, because that's what's going to help prevent the transmission of this. The other thing too is just knowing, and they'll lay it all out, but this is not the time that you send your kid with a little bit of a runny nose or a low-grade fever and give them a little ibuprofen before school. Not that anybody does that. This is the time that you need to keep them home just in case, or if any family members have symptoms of COVID or are waiting for their test results, or certainly if they have COVID, those kids need to stay home and quarantine at home as well, so that we don't risk bringing it into the schools. And I think just being a positive role model for all of this, both on the parents. If the parents are complaining about all of these rules and guidelines and not wanting to wear their mask, then the kids aren't going to be cooperative with it either. I think the teachers also, keeping a positive attitude, the flexibility and the adaptability, continuing with that theme as we go through this year. And then just the kids themselves, if some kids are wearing masks and have a good attitude about it, their peers are going to have a better attitude about it too. So I think all of us, parents, kids, administrators, employers, we all just need to be in this together. It takes a village, and there will be transmission. We have to be prepared for that. But it's how we deal with that and how we isolate that and how we prevent that that's going to be key in decreasing, and limiting and minimizing the transmission and making this as safe as possible, because this pandemic isn't going anywhere anytime soon, and we just all want to be in it together to help our kids receive an education wherever they may be.
Yep. One thing I've learned as a parent, the kids are watching, so be a good role model.
They
all right.
are.
Dr. Erica, thank you so much for your time this morning. We appreciate it. We wish you and your kids a good and happy and healthy, safe back to school. Thank you so much.
Thank you.
All right. We'll be right back after the break.